ecosphere and driving continuous
All right. Good afternoon, ladies and gentlemen. Welcome to the Huawei Cloud Live Expert Talks. My name is Alex. I will be your moderator for today. Please welcome our speaker, Dr. Vas, co-founder and CIO of regional telemedicine app, MyDoc. He's going to introduce to us MyDoc and how they make good use of Huawei Cloud and the HMS ecosystem to develop and deploy their app. Welcome.
Hi there. How are you doing, Alex? Yes. I'm Vas, one of the founders for MyDoc. We founded MyDoc about 8 years ago. It's based in Singapore. I'm a medical doctor who trained in London and came back and was looking at opportunities in the medical health, medtech technology kind of industry, and realized that there's a lot of opportunity in terms of telemedicine. And MyDoc was started together with another doctor from the US who moved to Singapore. And we looked at the opportunities in the region and decided that as a solution, there was nothing in the market for a full patient engagement platform in between medical consults. So patients go to the clinic and then they are lost to follow up, and until they go back to the clinic, the next visit after a few months. By having a companion with them, like MyDoc, we can enable them to be connected to their medical center, as well as get their prescriptions and have referrals to specialists and be able to store their medical record over time. The key value that we were building was to create a digital team, a medical team that's online. So from primary care to specialists to lab, we were looking at providing the ability to connect them and allow professional to professional messaging, allow teleconsults with the video consults between the professional and the patient, and get diagnostic data that was being pushed to the patient record. The workflow, we wanted to keep it very simple. We were inspired by all the WeChat and Line and all the applications. In 2013, when we created this workflow, we were the first to create a very simple chat-like interface with an online doctor, and then followed by the prescription and referrals. So very few things for the patient to learn, convenient, and very early access to care. At the back, we made it more robust with patient health record. We integrated the diagnostic lab data and ability for the patient to know that there's abnormal results and able to follow up online with a doctor. We saw a lot of early success with this in the corporate health segment, and the insurers were convinced that this was a way to manage cost as well as get early treatment for chronic diseases. MyDoc was early days. We developed a few patents, and one of them was to come up with a patient health record that we are quite proud of in terms of ability to look at all the multimedia data and decide what is the next step in the patient journey. So we help the patient decide who is the next best care that they should be receiving. We have recently got the Telehealth Company of the Year in 2020. This has been really good in terms of for the region. We are seen as thought leaders, and we are able to provide a high level of quality care. We are in multiple countries in the region. The list keeps growing. This was before COVID. After COVID, it's now 9 countries. The languages as well. We have been adding Cantonese, Mandarin, Bahasa, Indonesia, and Thai and Vietnamese. We have worked with multiple insurers in the region, and we have done projects with over quite a lot of MNCs, multinational corporations, that are used to having digital health in their countries. And when they come to Asia, Southeast Asia, they wanted a solution that could provide secure medical record with telehealth, which is exactly what we do. And so early on, we have worked with some of the top MNCs, hotel chains, IT companies, and banks to provide care for their staff. We are also part of the American Telemedicine Association and a member of the Sandbox for Telehealth in Singapore. We worked with National University of Singapore to develop a paper on how we can reduce cost in diabetes. And PwC published a paper for us. More recently, with COVID, there's increasing understanding of the importance when it comes to telehealth and the availability of care at any time when necessary. This has really increased the utilization, and the numbers keep growing. We think that the population is now more ready to do online teleconsults. This is a report by Bain, who looked at some of the data and published it. And we have seen that it's similar across the whole region as well. Early on in the pandemic, we developed a campaign called cureyourfear.org. This was a campaign to help reduce the questions when it came to not knowing what to do next and triaging the patients, the importance of either testing or rest and some over-the-counter medication, or if their symptoms were bad, to refer them on to a hospital. We created a chatbot that would ask questions for travel history, symptoms, so that it was much easier for the triage doctor to decide on what is the next best thing for this patient. So we do see that high-risk patients, we can identify and send them to the hospital if necessary. So that's what we do. I could explain a bit about our solution, which is very scalable. It is very nimble, and the storage is distributed, and we can host it on the cloud and share it across multiple regions. Now we have clustered it in Europe and Asia as well. And the application is very light. So in the front end, it is app native, iOS, native Android, and we have web-based interfaces as well. We have also worked as a solution within other platforms. So telcos, insurers, when they want to build their own applications, we have powered telemedicine within their application. We produce SDKs and APIs for that, and they are able to build their patient app or consumer app that they can power telemedicine with. And this is growing. A lot of telcos in the region are now looking into expanding with us on this solution. Right, so thanks.
All right, thanks for introduction, Dr. Vas. I'm sure your service is extremely significant during this difficult pandemic. So may I ask you why you chose Huawei And what is the solution that you deploy on Huawei Cloud?
So we deployed Huawei Cloud initially because there was a demand by one of our customers in Thailand, and we looked at all the existing infrastructure partners we had, and there was no one with a local presence in Thailand, and Huawei had a local data center, and we looked at the applications, and our CTO, Mark, decided that it was very intuitive, easy to learn, to deploy, and the low latency really helped, and as well as the security features and a lot of additional features like storage as well as IoT framework, a few other tools that we could use for future development as well. I will pass this on to our CTO to explain how we were able to scale up with Huawei. Yeah. Mark? Yeah.
Thanks, Russ. Yeah, so we were looking for a reliable cloud compute and object storage solution for Thailand, where we've just recently begun operations. Our existing cloud provider doesn't have a presence there. So with Huawei Cloud, it's very easy for our engineering team to learn how to use and manage the cloud services there with all the features we need already embedded within Huawei's cloud solution. We feel the Huawei Cloud Platform is future-proof for us and is able to give us embedded services from biometrics to the ability of using data lakes easily to begin improving our chatbot experience and allow for machine learning and to identify health problems earlier. We also plan to enter the remote monitoring market for our customers as more will need home care going forward. The IoT device management on cloud services being part of the Huawei offering is very likely to benefit us also. So we're currently using Huawei Cloud Compute for Cockroach DB database cluster stores. And it's very important for us, the low latency there being one of the key factors for us for having a stable solution. Kubernetes as well on Huawei Cloud intuitively allows us to maintain a standardized platform. So with fast application and service deployment times, and of course, the benefit of scaling and the resiliency that goes with it. So going forward, we'll also be using Huawei Cloud Object Storage Service to store sensitive documents securely within the Thailand region.
So it was quite an easy decision for us to choose Huawei for Thailand. And now we are looking at it for other parts of the region where Huawei is strong at. Yeah.
Do you have any other future plan for the future cooperation with Huawei?
Yes. So there are several features in Huawei that are very interesting in hosted on the cloud, like the IoT device management, conversational bot interface, data lake, and analytics, video AI. So these are things that we have been looking at. I'll show what we have been thinking about and how to use this in healthcare. Our roadmap, for example, we looked at several ways in which we can now give continuous care and not just one-off teleconsults. So continuous care will mean that we are able to monitor remotely some of the data from the patient and then provide care according to the need. Looking at IoT data, we are API driven. We can receive data from labs as well as IoT devices and mix them with the conversation and create a context. An example would be the tracking wristband, which also calculates temperature, pulse, respiratory status, and able to trigger and allow us to follow up on the results with our network of professionals. We are looking at home care and how the elderly and the falls detection at home is something that would prevent a lot of hospitalization and early detection of problems with IoT as well. And visual AI could also be very useful. in this circumstance. Rehab is another area we are looking at, tele-rehab, and AR and VR is going to be useful for virtual occupational therapy. We already started a project now with National University of Singapore and students working on this program. In Hong Kong, we have created MyDoc labs and going to look at the 5G environment. And of course, as a 5G environment, Huawei is a leader. So we are looking at working on some of those tools that we can use. Yeah.
All right, thank you so much. Here's a little bit of information for our audience online. In fact, Huawei Cloud brings 3 major benefits to accelerate MyDoc and other enterprise customers in digital transformation and intelligent innovation. Huawei Cloud provides diverse cloud architecture and unparalleled performance, which cover from VM, container, and serverless, offering to meet different workload needs. Huawei Cloud provides reliable and secure data protection with 50+ global security certifications to strictly define business boundaries. Huawei Cloud is future-oriented by leveraging open ecosystem that harness chip-device pipe cloud synergy. In relation to Huawei mobile services, we wish to help developers to build quality applications for developers with little cost and lower development threshold. We plan to launch HMS core services such as analytic kits, ML kits, push kits, awareness kits, and etc. to build smarter and better experience for our users. To encourage developers and content providers to join us to build this ecosystem, Huawei would like to offer more benefits for them. Those who launch their app on App Gallery and users of Huawei Cloud can get up to 20K USD value cloud coupon to do developing and testing. And those who develop app integrated with HMS core kits can have a 20K USD cloud coupon for every consumption on Huawei Cloud. Meanwhile, our app gallery will give the app promotion resources such as flash screen, banners, and other recommendation slots to attract more downloads and active users. Yeah, thank you, ladies and gentlemen. Thank you for joining us today. This brings today's Huawei Cloud Live to an end. Please don't hesitate to reach out if interested. We are looking forward to meeting you in the future. Thank you very much.
Thank you.